Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Surgery, focusing on preoperative and postoperative care. Let's get started with question number 1. For the following case, in addition to high-flow oxygen supplementation, the patient should be immediately placed in which of the following positions? A. Left lateral decubitus. B. Prone. C. Right lateral decubitus. D. Semi-recumbent. A. Supine. The case scenario is: a 65-year-old man is evaluated in the hospital for acute onset shortness of breath. The patient was originally admitted 5 days ago for peritonitis due to a perforated peptic ulcer, for which he underwent surgical repair. A large bore, right internal jugular venous catheter was placed during the operation. Today, he was out of bed, sitting in a chair, and comfortable on room air. The internal jugular catheter was removed. Minutes after catheter removal, the patient develops acute onset shortness of breath and cough. On examination, he appears in respiratory distress. Blood pressure is 110/60. Pulse rate is 110 per minute, and respirations are 25 per minute. Oxygen saturation is 85% on room air. The jugular veins are distended. Breath sounds are normal and equal on both sides. The question is: in addition to high-flow oxygen supplementation, the patient should be immediately placed in which of the following positions? Your options are: A. Left lateral decubitus. B. Prone. C. Right lateral decubitus. D. Semi-recumbent. A. Supine. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is A, which is left lateral decubitus. This question is designed with the focus to assess your ability to perform clinical interventions. This patient with sudden onset respiratory distress following removal of a central venous catheter has most likely developed a venous air embolism. The venous circulation is susceptible to air embolism due to relatively low intravascular hydrostatic pressure. Venous air embolism travels to the right ventricle, where it can obstruct the right ventricular outflow tract, or it can travel further to the pulmonary arterioles, where it can obstruct pulmonary capillary blood flow, leading to ventilation perfusion mismatch and hypoxemia. Obstructive shock and cardiac arrest can result. Patients with suspected venous air embolism should immediately be placed in the left lateral decubitus or left lateral Trendelenburg, which is left lateral decubitus with head down position, which traps the venous air embolism on the lateral wall of the right ventricle, preventing right ventricular outflow tract obstruction and further embolization of air into the pulmonary circulation. High-flow oxygen, or, in severe cases, hyperbaric oxygen, is also important as it shrinks the air embolus by encouraging the absorption of nitrogen gas into the blood. If you choose any option other than A, you are wrong. Let's briefly discuss the other options. B. Prone. Prone positioning reduces atelectasis in the posterior lung, where most of the lung mass is located, and is sometimes used to improve oxygenation in patients with severe acute respiratory distress syndrome and persistent hypoxemia despite optimal mechanical ventilation settings. C. Right lateral decubitus. Right lateral decubitus positioning is likely to encourage movement of air into the right ventricular outflow tract and may worsen the clinical manifestations of venous air embolism. D. Semi-recumbent. Semi-recumbent positioning may lower the risk of ventilator-acquired pneumonia in intubated patients on mechanical ventilation. A. Supine. Patients with suspected arterial, rather than venous, air embolism should be placed in supine positioning, as it helps prevent the embolism from traveling to the brain and causing a stroke. Your take-home message from this question is that venous air embolism is suggested by sudden onset respiratory distress following removal of a central venous catheter. Patients with suspected venous air embolism should immediately be placed in the left lateral decubitus position to trap air in the lateral right ventricular wall and help prevent right ventricular outflow tract obstruction and embolization of air into the pulmonary circulation. High-flow oxygen is also important to encourage absorption of the air embolus. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.